Now tell us what you have witnessed so far since this intense fighting broke out.
Yeah, thanks very much. I think since the fighting started to be intense in Goma, we have seen a lot of people, some of them running through to Rwanda, some of them running again through Sake, which is also a war zone, trying to escape all this fighting that is happening in Goma. And also majority of the people, they've decided to hibernate because intensive fighting started during the night. Even some of our staff, I've got almost 47 staff members in Goma, and they're in hibernation. And they are reporting that there is so much fighting nearly everywhere. They've heard as well that, some of the security forces have left Goma. And then in the houses where they're hibernating, there's no electricity, there's no water. And also some of the people that had been displaced from Sake, from Kanyaruchuru, Kibati, they are occupying schools, they are occupying clinics, they are occupying public places and hospitals. And they are reporting that as well in the hospitals, there are a lot of people that are injured and unattended because of the war. They are reporting as well that some of the nurses cannot access the hospitals because of the fighting that happened since last night until this morning and afternoon.
Manenji, has President Felix Tshisekedi spoken about this publicly yet?
We are yet to hear what he's saying, but the message has been put across that he is not supporting what is happening. And then again, we've heard through media that President Ruto is going to mediate because it's a matter of urgency, because what is happening is affecting close to 2 million people, in addition to the 600,000 IDPs that have been displaced who need humanitarian assistance. So you can imagine Goma having no water, having no electricity, whilst Goma is also prone to cholera outbreak. We are likely to have outbreak. So we need peace now than tomorrow.
And so how does the escalation of this violence in DRC impact the work that you do as Oxfam and other aid organizations there?
This conflict has created challenges to access the people that need humanitarian assistance. So we are not able to go to Sake, we are not able to go to Minova, we are not able to go to Kanyaruchuru, and also able to go to Ruchuru to help the IDPs. Since yesterday and today, for example, Oxfam was not able to provide water in the Lushagala IDP site in Mugunga, where we are responsible for providing water system. Other NGOs also and UN agencies were not able to provide assistance that include food, even education to the kids, and psychosocial support to the people.
Now, what other options do the Congolese people have? We have seen so many of them fleeing from areas in Goma. What other options do they have? Where are they going?
What option they have is some of them have crossed into Rwanda. We thank also for accepting for them to cross over for safety. Some of them as well, they've went back to areas that are also controlled by M23, like Sake and other areas around Masisi Mweso. And while some managed to turn back and go also to Ruchuru, but some are actually can't do nothing because they were caught unaware. They're in the middle of the fighting and the bullets are flying everywhere. They can't go anywhere. They are staying in their houses while it's waiting for the opportunity to escape.
And very quickly, what is M23, a rebel group, demanding?
To be honest, I have no idea. Yeah.
So nobody knows what they are up to. What are they really running to? Are they heading towards Kinshasa, the capital?
That one I don't have an idea because, I've not yet spoken to the leadership. So, yeah, I can't confirm anything.
Okay, what else have you seen in terms of, security for women, for children? We've seen a lot of them carrying a lot of things, just going left, right, and center. Who is going to help these people?
So it's so terrible what is happening. Children are hungry, they're in bad shape. Women are hungry, in bad shape. Elderly people, some of them they've been left at homes with no help because they can't escape like other people that still have energy. This is our worry. We are saying all the donor communities, can they provide enough funding to fund? At the moment, humanitarian actors were affected by the policy of President Trump and his government. where they say they want to suspend funding to humanitarian assistance. So we are engaging with the USAID to see if they can actually convince the administration in Washington to actually make sure that they made available those funding. USAID has been funding maybe 70 to 80% of the humanitarian assistance in East DRC. And suspending this funding means crucifying people to death. You also mind that humanitarian assistance, denied or delayed is like you are committing genocide. We definitely need to help these vulnerable people that are in really great need of protection, that are in need of food, in need of water,